welcome to Urgent Care on Call. My name is Dr. John Essen, also known as Dr. E to many of you. I am a practicing emergency medicine physician, and by popular request, I am here to discuss heart attack and everything you need to know about preventing a heart attack. Let's start by talking about some numbers. Heart disease is the leading cause of death in the United States. About 735,000 Americans suffer from a heart attack each year. That's about one heart attack every 43 seconds. Very alarming. And about 525,000 of those heart attacks are the first for the person affected, while roughly 210,000 of them appear in people who have previously had a heart attack. As you can see, this is a really big deal. Symptoms of a heart attack in men and women usually include the chest pain that radiates to the neck, radiates to the back, radiates to the upper extremity, or even the stomach. A lot of people come in with shortness of breath, swelling in both lower extremities, nausea, vomiting. Some may even have complaints of indigestion or heartburn, sweating, palpitation. However, one thing to keep in mind is that women also experience, in addition, pain in the upper abdomen, extreme fatigue, dizziness, and lightheadedness or even fainting. If someone is having a heart attack, presents with any of the symptoms I just mentioned, then it's relatively easy to make a diagnosis and take care of these patients. However, there are times when people having a heart attack experience no symptoms at all. And the medical terminology for this is the silent ischemia, also known as the silent killer. So what is really a heart attack? What is a heart attack? A heart attack happens when the flow of blood that brings oxygen to the heart muscle is significantly reduced or cut off completely. This is often a result of atherosclerosis, which is a process whereby arteries narrow due to a buildup of plaque, which is usually made up of fat or cholesterol. Sometimes these plaques do break off and blood clots form around them, blocking blood flow to the heart, starving it of its much needed oxygen and nutrients, and now you have ischemia, causing damage to the heart muscle. This damage to the heart muscle is what leads to a heart attack, or what is medically known as myocardial infarction. So what do we need to do to prevent a heart disease or a heart attack? One, leading a heart-healthy lifestyle with a nutritious, low-fat diet and exercise is the best way proven to prevent heart disease and heart attacks. A heart-healthy diet includes nutrient-rich foods such as fruits and vegetables and whole grains. Obviously, this does not include fat or sugar-based products. Other tips to prevent heart attacks would include not smoking, limiting alcohol, reducing stress, and managing comorbidities such as diabetes or high blood pressure. We had quite a few questions on the role of exercise in reducing heart attack. There is no debate whether regular exercise can help prevent heart attacks. It has been proven that just 40 minutes of moderate to vigorous intensity physical activity 3 to 4 times a week can lower blood pressure, lower cholesterol, help maintain healthy weight, not to mention the role it plays in managing stress. So let's talk about the diseases or conditions that put a person at risk of having a heart attack. This includes diabetes, high blood pressure, cholesterol, obesity, smoking, aging, family history of heart disease, and alcoholism. So now that we know what we need to know about heart attacks, what do you do if you have some of the symptoms that we just mentioned? All I can say is that if you're having a heart attack or having any of those symptoms, make sure that you have a means of reaching out to some family members, friends, or dialing 911 But this is not the time to surf the internet. If you have your phone around you, 911 and get some help. That 911 operator may request that you take a baby aspirin if you're not allergic to it. Great idea. However, at a later date, a discussion with your primary care physician regarding aspirin therapy to prevent any future heart attacks is highly recommended. So that's all I have to share about what you need to know about heart attacks. Don't forget to comment or let us know about topics you would like us to discuss in the future. And also, don't forget to reach down and subscribe to our channel and become a subscriber. And if you would like to be notified about new videos, reach down also and click on the little bell next to the subscribe button. However, if you have any questions or non-emergent healthcare needs, you can link up with us on our telemedicine platform at www.urgentcareoncall.com. Thank you, and thanks for the thumbs up.